The problem with having endometrial tissue in other areas of your body is that the tissue will break down and bleed just like in your uterus.
But the blood doesn't have anywhere to go.
Over time, this blood and tissue develops into cysts, scar tissue, and adhesions.
This is scar tissue that causes the organs to bind together.
Most treatments for endometriosis aim to prevent ovulation. One example is taking birth control pills.
When you are trying to get pregnant, you'll stop taking these treatments.
Symptoms of endometriosis.
The most common symptom of endometriosis is pain, including pelvic pain and strong cramping.
But infertility can unfortunately also be a symptom and side effect of endometriosis.
An estimated 1/3 to 1/2 of women with endometriosis report difficulty getting pregnant.
How does endometriosis affect pregnancy?
Infertility due to endometriosis can be related to several causes.
The first is if endometriosis affects the ovaries and/or fallopian tubes.
An egg must travel from the ovary, past the fallopian tube, and to the uterus for fertilization before implanting into the uterine lining.
If a woman has endometriosis in her fallopian tube lining, the tissue may keep the egg from traveling to the uterus.
It's also possible that endometriosis could damage a woman's egg or a man's sperm.
While doctors don't know exactly why this occurs, a theory is that endometriosis causes greater levels of inflammation in the body.
The body releases compounds that can damage or destroy a woman's eggs or a man's sperm.
This can keep you from getting pregnant.
Hint to see your doctor.
Some doctors may recommend seeing an infertility specialist before you even think about trying to become pregnant. An infertility specialist may conduct blood tests, such as an anti-Mullerian hormone, AMH, test. This test reflects your remaining egg supply.
Another term for egg supply is ovarian reserve. Surgical endometriosis treatments can reduce your ovarian reserve, so you may want to consider this test when thinking about endometriosis treatments.
The only way to truly diagnose endometriosis is surgery to identify areas where the endometrium is present.
But these surgeries can result in scarring that affects fertility. How to improve your chances of conceiving with endometriosis. Currently, there's no evidence that taking medicines can improve a woman's chances of getting pregnant.
But doctors may prescribe medications, such as progestins, as a means to increase the amount of pregnancy hormones in a woman's body.
It's also important to live as healthy a lifestyle as possible when you have endometriosis and are trying to get pregnant.
This can reduce inflammation in your body and prepare it to help your baby grow and thrive throughout a healthy pregnancy.